Hello, everybody. Sorry about the delay today. I am Dr. Patel, and I am here talking about arthritis in the low back. Last week, we talked a little bit more about anatomy and sciatica and what are the common causes of sciatica. And we've talked previously about various different things, including how to read your low back MRI. So if you've missed any of our previous talks, then please go to our website or our YouTube page. Our website is fxregencenter.com, and all of our Facebook Live episodes are there, as well as, of course, on Facebook and on our YouTube also. But today we're going to be talking about the low back, and specifically, how is it that arthritis happens? What causes arthritis to happen in the low back? And really, why does it not matter? Why is it okay that arthritis happens? And why is it not something that we should be worried about? But also, when is it that we should be worried? What are the signs that we should be thinking about and considering? So, if you have any questions about this topic or any other topic, then feel free to comment. I'll try to answer the comments as they come. If you have any comments or questions about your particular condition, or if there's any topics that you want me to discuss at a future time, then feel free to email us at info@fxregencenter.com, or you can comment or DM either here or on Instagram, or really anywhere that you can find us. So without further ado, what is it that causes arthritis in the back? So we've gone over back anatomy before, but I think it's important for us to review that, because if we understand the back anatomy, then we can get a really good understanding of why is it that arthritis takes place. So as I've described before in the past, I described the spine as a stack of coffee mugs sitting on top of each other. So these are your mugs here. And this is the front of the body, this is the back of the body, and we have these coffee mugs kind of sitting on top of each other here, right? And in between the coffee mugs is a water balloon that's completely filled with jelly. That's our disc, right? And it's actually like it's multiple layers of rubber, and then the jelly on the inside, multiple layers of rubber, and then the jelly on the inside. And when we're teenagers, when we're kids, that disc is completely filled with jelly, so it's nice and cushiony, right? But as we get older, and you guys have heard me say this before, if you're my patient, you've definitely heard me say that it's after the ripe old age of 20 or 30 that we start to get disc degeneration. And ultimately, what that disc degeneration means is that there's less water in these water balloons. That is a part of the early stages of the osteoarthritis picture. Because what happens is that balloon, as it gets less water in it, instead of being nice and cushiony, it starts to get a little bit more jiggly. And as that jiggliness occurs, well, then we start to get some movement of the vertebral bodies in different directions, right? As those bodies move, as there's some increased motion that takes place, a couple different things happen. So first off, we have these ligament structures that actually connect all of the bones together. We have ligaments in the front of the vertebral body. We have ligaments on the back of the vertebral body. We have ligaments that surround the back of the spine here and connect all of these things together. We have ligaments all over the place connecting bones to bones. And these ligaments are strong supportive structures. But again, as you've heard me say before, the ligaments are like those thick rubber bands that surround broccoli in the grocery store, right? So they're strong, they're supportive, but there's a little bit of stretch to them. But as there's some increased motion that's taking place of the vertebral bodies, well, these ligaments are going to start to slowly get stretched. So these ligaments start to slowly get stretched here, and we see some kind of looseness start to occur in these various different ligaments, okay? As these ligaments start to get looser, then there's more motion that takes place between the vertebral bodies, and over time, the facet joints back here, where one bone meets another bone, And this is areas that are on both sides of the spine. So there are joints called the facet joints on either side of the spine towards the back. Those facet joints start to rub against each other. And over time, that rubbing, that friction is going to cause some roughness of the bone. And over time, the smooth surface called the cartilage starts to gradually wear away. The bone starts to get rougher. And that is how the osteoarthritis starts to develop. The roughness of the bone that takes place initially is because of that extra motion that's taking place. But as that extra motion continues and continues, the bone is like, hey, we're getting really unstable over here. So the bone actually bulks up a little bit in order to try to provide stability where the stability is decreasing. So as the ligaments start to get looser because of the extra motion, the bone is then reacting to that looseness of the ligaments and trying to actually bulk up. So if you can imagine then, if the bone is actually gonna get bigger and bulkier, it's trying to actually provide stability to that joint. And you can see that kind of changes in orientation. The bone actually shifts, it grows, it adapts, because as that is providing more instability, the bone's like, hey, we gotta provide some more comfort here. So the bone actually bulking up is, again, those bone spurs that can occur is a reaction that the bone has to that extra friction, extra motion that's taking place. In some circumstances, because of that extra friction, the bone could be like, hey, we need to get out of the way. And sometimes the bone actually deteriorates a little bit, or specifically with the facet joints in the low back, the orientation of the joints could actually change. So if there's a lot of pressure coming at me, then I'm going to eventually be like, all right, either I'm going to bulk up in order to accommodate that extra friction, that extra pressure, or I'm actually going to start to move out of the way in order for that motion to actually take place. And that can allow for the bones to actually start to move more, and that can cause what's called slippage of the vertebral bodies, or ultimately what's called spondylolisthesis. So then what takes place is then the bone actually can shift forward or backwards compared to the spine, the vertebral body above or below it, and that spondylolisthesis or slippage of the vertebral bodies is then allowed to take place by both the ligaments being loose and the bones actually trying to get out of the way of that extra friction that's taking place. Over time, as there continues to be friction or pressure or irritation in that area, the bone, will change position, it'll bulk up, but eventually over time the bone can actually start to break down. Inflammation can occur, and I'll get into that in a second. But little pockets of inflammation can occur, which could be seen as cysts, either within the bone or even pockets of cysts can form from the capsule that surrounds a joint. And ultimately, over time, the bone actually either starts to crumble or break down or die, or the bones that are at that joint start to fuse together, and autofusion takes place, or fusion that takes place by itself. So ultimately, that is the end stages of osteoarthritis. Either that bone-on-bone, true bone-on-bone fusion takes place, or the bone starts to break down. Got some comments here. Hello. Sparta, Susan, Raul, thank you for joining. Appreciate the comments. Feel free to hit us up if you have any questions. But I hope this is making sense, because I think it's important for us to understand the degenerative process that takes place with the joints. Now, that being said, so that's the kind of the whole spectrum of what goes on, right? The discs, the shock absorbers, those water balloons start to get dehydrated. There's a little bit less fluid in them, so there's less cushion. There's a little bit more motion that takes place. The ligaments start getting looser, and then the joints start to react to that extra motion that's taking place, either by getting out of the way and allowing for slippage to take place, or bulking up in order to try to provide stability. Eventually, that bone either breaks down or starts to fuse together. With the exception of the end stages with the exception of the end stages of the osteoarthritis, where the bone's actually breaking down or dying, right? With the exception of that, the rest of osteoarthritis actually does not necessarily equal pain. I'm going to say that again. With the exception of the end stages, when the bone is actually breaking down or dying, the rest of osteoarthritis actually does not necessarily equal pain. It can be painful. It can be painful, but it does not have to be. And I'll tell you this because if you took an X-ray or an MRI or whatever of your spine, for really anyone over the age of 20 or 30, you're gonna see some little things going on. And what's interesting is that I've seen patients that are 60, 70, 80 and experiencing back pain for the first time. It's not because arthritis all of a sudden came on when they were 60 or 70 or 80. They actually had arthritis that was growing for a bit. But it wasn't until something happened that caused the joints to become painful. And that's a key thing. Now, arthritis has a lot of other factors involved with it. Genetics plays a factor. Some people are more or less predisposed to have osteoarthritis. There are different types of arthritis that are unrelated to these degenerative changes, but I'm speaking specifically about degenerative osteoarthritis. Now, there's different factors that take place in terms of the pain related to osteoarthritis. Some people are more apt to or less apt to have pain associated with the osteoarthritis. But the osteoarthritis itself does not necessarily equal pain. Interestingly, even at the end stages, if you're actually having autofusion occur, if the bones are fusing together, then that actually does not necessarily cause pain either. But there's a couple different reasons why a joint that has osteoarthritis can become painful. Number one is if the mechanics of that region have changed, and now when we're moving and we put abnormal pressure into that area, if there's abnormal mechanics in that region, that joint itself can become irritated, and that is what we broadly call mechanical back pain. But we always talk about arthritis, and we kind of couple the thought of arthritis with the thought of inflammation. So what's interesting is not all arthritis causes inflammation. So what is inflammation? Why does it occur? And why does it occur more frequently or more painfully in osteoarthritis? Well, in certain osteoarthritis conditions, again, this is not a blanket statement. There's a lot of different types of pain associated with osteoarthritis. But when we talk about inflammation, inflammation is actually the first part of healing. When we get an injury, we get inflammation, and then that inflammation goes away, right? When you're a kid and you twist your ankle, or if you twisted your knee or something along those lines and you got that swelling that occurs, well, that swelling is inflammation. And it's a negative process because it's painful, but it's a negative process because it's getting rid of the damaged tissue from the injury that you had. And part of that process is actually calling all of your local stem cells to the area, because we have stem cells throughout our body. And then that's how healing takes place, right? That's how healing takes place, because we got to get rid of the damaged tissue in order to lay down the foundation for healing. Well, in osteoarthritis, the local environment is not as healthy as that osteoarthritis progresses. So the local stem cells that live inside the joint are not as healthy. So when we are not moving properly, or when we put abnormal pressure into a joint that has osteoarthritis, well, then it's easier for that joint to get irritated, and it's easier for that joint to stay irritated. Because the local environment is not as healthy, that local environment cannot regulate the inflammatory process as well. So when that inflammation occurs, or when you get that injury, then you get kind of stuck in that inflammation. And that actually just continues to make the situation worse. So when is it that we have to care about arthritis, and when is it that we don't? So if you don't have a lot of pain, or if you've had pain once and it went away, or you had pain, you got an x-ray, it showed osteoarthritis, you did something, but the symptoms actually resolved, well, to be blunt, I don't care if you have osteoarthritis. Everybody does, right? What I care about is if we're having signs that arthritis is getting irritated. And so what are those signs? One of the common signs seen with osteoarthritis is stiffness. Stiffness. Now this is like you've been sitting for a long time, or you're lying down overnight, you get up in the morning, you're feeling stiff, you're feeling achy. It takes some time to get the body moving. That's a sign of osteoarthritis. Now it's not something that we need to worry about or concern ourselves about, because doing some simple exercises to get the body moving, get the joint lubricated and all that could be sufficient to help reduce the stiffness, the pain, and to prevent things from getting worse. But if that stiffness is lingering more, or if it's starting to get associated with pain, then that's a sign that we need to do something about it in order to prevent it from getting worse. And what do we have to do in that situation? Well, more often than not, it's strengthening the muscles around the knee, getting the body moving properly, whether it's the knee, the low back, the neck, the shoulder, whatever it is, getting the body moving properly is what can allow for us to take pressure off of the joints, decrease the inflammation or pain associated with the joint, and also slow down the progress, prevent things from getting worse. So there's a lot of research that suggests at this juncture that exercise is actually one of the best and most effective treatments for osteoarthritis, and in fact should be our staple, should be our fundamental treatment that we build everything else on top of. Other things that we need to watch out for is if we're starting to see that there's deformity forming in the joint, then that's signs that the osteoarthritis may be progressively worsening. It's harder to visualize this kind of stuff in the spine than compared to other areas like the knees or in the fingers or things along those lines. But the signs that we might be starting to develop some deformity in the spine due to osteoarthritis is particularly if you're starting to have some decreased range of motion that's taking place. Now that range of motion could be because of your muscles being weak or muscles being tight or other various different things. But if you're starting to feel stiffness with different ranges of motion, or if you just can't go past a certain range of motion because of pain, then that's something that we want to be proactive about getting checked out and just making sure, all right, this is how we strategize around this. This is the particular treatments that might be necessary. So Patty asked, once the damage is done, what can we do to prevent further degeneration? That's a great question, Patty. So first and foremost, I have to correct the statement. I have to correct the question. First and foremost, I want to remove the word damage from our vocabulary, because osteoarthritis is a degenerative condition. It is a part of getting older. It is a part of life. It is not damage. Right? So first and foremost, we need to remove that as a part of our vocabulary altogether. It is a degenerative process, meaning that it is a one-way street, meaning that somebody that has some osteoarthritis at 40, 50 years old, chances are it's going to be worse at 80 and 90. Right? But there are things that we can do to slow down the progress of the degeneration, even perhaps slow it down till it's stopped. And the main two things are what we do with our body and what we put into our body. If we're completely sedentary, or if we're completely, or if we're repetitively doing the things that are causing irritation to the joint, then that's something that's going to progressively make it worse. But if we improve things like the way that we're moving, if we start adding exercise, weight-bearing exercise, strengthen the spine, take pressure off of the areas, if we incorporate some level of activity, it doesn't have to be crazy, but some level of activity to strengthen the muscles and take pressure off of various regions, that's something that can slow down the progress of the disease. The other thing is what we put into our body. Because, like I said, arthritis does not equal inflammation, but it's easier for a joint that has arthritis to get inflamed and to stay inflamed. Well, if that's the situation, and we're dealing with some pain associated with the osteoarthritis, well, we don't want to feed that inflammation, right? We don't want to add fuel to the fire. So there's not a ton of research on this, but there is some growing evidence that suggests that certain foods can cause inflammation to be better or worse. So we need to start thinking, if we're appreciating some of the yellow, orange, red flags of osteoarthritis, if we're appreciating some stiffness, some pain, some decreases in change or range of motion, well, then we need to be proactive about it. And instead of eating, super sugary foods or sodas and things along those lines, processed meats, all these things that have the potential of actually causing inflammation or disease to be worse, well, then we're just adding fuel to the fire. So, interestingly, I've had some patients, completely anecdotally, have a significant reduction of their pain by just changing their nutrition. And of course, I say this as I finished eating some pizza for lunch today. But the reality is that I've had some patients by eliminating processed sugars and decreasing or eliminating dairy, increasing multicolored vegetables, they're actually able to improve some of their pain symptoms even without doing anything else. But especially if you discover that you have some osteoarthritis and you're having some symptoms that are suggestive of that becoming an issue, then the exercise and the nutrition are the most fundamental things that we can focus on, that we have control over in order to slow down the progress of that disease. And then if that's not enough, if we are finding issues with instability, if we are finding issues with pain or anything along those lines, there are actually various injection treatments that can be done that can improve stability, that can improve the negative environment inside of joints. Things like using sugar water prolotherapy injections, or using a patient's own blood growth factors, or PRP. These type of injections can actually strengthen soft tissue structures. They can actually improve the negative environment inside of joints that have osteoarthritis. The things that we want to try to avoid are things like corticosteroid injections, because cortisone injections into joints can actually make osteoarthritis worse. In fact, even numbing solutions, certain types of numbing solutions, can actually be harmful for joints as well. So definitely things that we need to think about, things that we can do, things that we want to avoid in order to optimize our body as we're getting older. But we also have to take a step back and realize that just because we have osteoarthritis, and nearly all of us do or will, is not the end of the world. It's not something that we need to cry about or perseverate over or focus on. We need to focus on getting the body moving and healthy from the inside out. So I hope that all made sense. Kind of blabbered on a little bit about why arthritis isn't the end of the world, but I think it's so important that you guys hear that, because we focus so much on the fact that we have arthritis, or we have this, or we have that, but in reality the reality is that our bodies are resilient things, and the type of treatments that I do really are just nudging your body in the right direction, helping improve your body's functioning, but it's ultimately things that we have in control of ourselves. That's really important at preventing osteoarthritis from becoming a hindrance to our lives. So if you found this helpful, please like this video, share it, tell your friends, tell your enemies. Everybody ought to know that osteoarthritis is not the end of the world, but this is how arthritis ends up happening in the spine, and these are the things that we got to watch out for about why it does or does not matter. So if you have any questions about this or any other topics, please comment, DM, email us at info@fxregencenter.com. I may or may not be on next week because my brother's going to be in town, but we'll keep you in the loop, and looking forward to seeing you next time.